Hi, guys. It is summertime, and I'm getting a lot of questions about constipation. With kids and their diets constantly changing over the summer, I happen to get a lot of questions about this because your diet can affect things. This is going to be a multi video series basically because there's a lot to explain, and in order to understand everything, um, I have to explain a lot to you and go through the process. I think the more you understand it, I think it just makes it easier to manage constipation. So I'm going to go through it pretty in detail. In order to understand constipation at first, you have to understand just normal bowel function. So once you understand normal bowel function, then everything kind of falls into place in a way. So first of all, and I have this little diagram, which I'll try and show you too. I'm trying to multitask. I don't know how good I am at this. So you eat food. Obviously, we eat the food. Saliva breaks it down in the mouth. It then moves from, you can see here, there's your mouth. It then moves from your mouth and down your esophagus into your stomach, which is right down there. Once it hits your stomach, it then goes in out, it processes a little bit in your stomach, and then it moves into the small intestine. The body starts absorbing a lot of nutrients here in the small intestine, leaving behind more of the liquid waste products in the small intestine. So liquid is moving through the small intestine by what we call peristalsis, which is like this wave-like motion of the intestines. You get stretching of those intestines, and that's what actually triggers this peristalsis motion. So taking something like fiber or some kind of like bulking agent that you see at the store can trigger the small intestine to move things along, and therefore creating poop, and eventually you poop. So as the small intestine absorbs all the nutrients, the liquid then moves into the large intestine. So you can see here, this small intestine are all those little coils in the middle. So you have your stomach, and that leads into the small intestine, all these coils. And then once it leaves the small intestine, it goes into this large intestine, which is this big old loop that wraps all around your small intestine. So it moves into the large intestine, the colon. That's where the motion really slows down, and that this is where water gets absorbed and thus results in that more formed poop. When it flies through your large intestine is almost like when you get diarrhea. There's just so much water that is left over in there. So stool, once it goes through your large intestine, it then will hang out here in your rectum, which is before your anus. So it hangs out there in your rectum until your body signals, hey, it's time to go poop. And then it moves forward more towards its exit point. So this requires some relaxation of other muscles in order to release the poop. So many people get into a routine when they poop. This can be affected by different foods you're eating, medications, having to use a public bathroom. This is huge for people. And even traveling and vacation. You notice that, hey, my pooping pattern is way off schedule. So that's a very normal thing. Pooping should occur about 1 to 2 times per day, and the poop should be very soft. It should not hurt when you pass it. You should not be clogging toilets when you pass it. So that's kind of when you know you're on a normal pooping pattern. That's all I want to cover for today. Next week, I'm going to talk about what is constipation, what causes constipation, and like how does it occur in children. Like I said, I'm going to take this in very small chunks. We'll eventually get to treatment and management, but I just want to give it to you in small bits so you have a good understanding of everything. Okay? Thanks.